History as it happens, March 16, 2021. Pandemic 1 year later.
A Washington state resident fell ill after returning from Wuhan, China.
This is an evolving situation. Literally every day we learn a little bit more about it.
A lot of people think that goes away in April with the heat.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero.
It's going to disappear. One day it's like a miracle. It will disappear.
The world never got a miracle, but we do have vaccines. A year after an invisible deadly pathogen turned our lives upside down. Health experts and historians say, beware, it's not over. Another wave of death and misery could come our way. Echoes of 1918. As we report History as it happens, a podcast from the Washington Times. I'm Martin DeCaro.
A year ago, we were hit with a virus that was met with silence and spread unchecked. Denials for days, weeks, then months. That led to more deaths, more infections, more stress, and more loneliness.
Hey everyone, welcome back. 1 year ago, I went to dinner at an Indian restaurant in my neighborhood. It was a Thursday night and the place was busy as usual, and no one was wearing any masks. But I remember I had thought about canceling. I wanted to see my friends that night, but we were worried about maybe catching something. And I remember talking to my coworkers the next morning about whether I had made the right decision. Now, the reason I can recall all those details about an otherwise normal night out with friends, well, that's obvious now, isn't it? Every one of us has a story to share about that last moment of normalcy and sanity in March 2020, before social distancing and Zoom became parts of the lexicon, before we spent our last in-person moments with friends and loved ones at bars, sporting events, birthday parties. The outbreak occurred months before, but it was March when we faced reality, or reality imposed itself on us, shattering the notion that our modern, convenient lives could not be so disrupted. And soon enough, another notion was shattered, our false sense of security that we couldn't be visited by mass death.
As of now, total deaths in America, 527,726.
Last April, after normal life had been upended, I read The Plague by Albert Camus. It was strangely therapeutic. Camus wrote, "Everybody knows that pestilences have a way of recurring in the world, yet somehow we find it hard to believe in ones that crash down on our heads from a blue sky. There have been as many plagues as wars in history, yet always plagues and wars take people equally by surprise. Stupidity has a knack of getting its way, as we should see if we were not always so much wrapped up in ourselves." That's Albert Camus. So much has happened that we might never have thought possible, but to my eyes, the most perplexing thing of all was the politics. Masks became political amid confusing and contradictory information about whether we should even wear them.
Cloth facial coverings are effective, as far as we know right now, based on the best available evidence, at preventing you from spreading disease to other people. So no inconsistency there. It's just the recommendation changed because the information changed, and that's what you want from your public health leaders.
Closing businesses became political. Whether one believed the virus was contagious seemed to suddenly be determined by one's personal politics. All of us know someone who dismissed scientists and glommed onto whatever they could find online that conformed to their biases, in an attempt to deny reality. And then there was the daily White House briefing.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way.
For months, President Trump dispensed misinformation. He refused to fully endorse masks. He held crowded campaign events against the advice of his own medical experts. And he caught the virus himself, a surreal timeline.
It is extremely successful. The hydroxychloroquine, coupled with the zinc and perhaps the zithromycin.
And you know what else is almost impossible to believe? During the 1918 flu pandemic, President Woodrow Wilson did not make a single public statement about the virus. Not one. And public officials and newspapers back then dispensed really bad advice.
And when they finally, very late in the game, closed schools, theaters, saloons, and so forth, one of the newspapers actually said, "This is not a public health measure. You have no cause for panic or alarm." Now, the readers knew this was utter nonsense.
That's the voice of historian John Barry. He's our guest today, one of the top experts on the 1918 pandemic. I think you're going to find our conversation really compelling because of the painful, tragic similarities between then and now, and the important differences too. To start, the 1918 pandemic was far more virulent and far deadlier in this country and across the world. Estimates start at about 50 million fatalities, 675,000 in the United States alone, although the U.S. population was just a third of what it is today. What resonates across the decades is the human misery, the human folly in the face of an invisible force of nature, and the unwillingness to adjust when faced with new information. John Barry is a distinguished scholar at the Tulane University School of Public Health and Tropical Medicine, and he's the author of The Great Influenza, the story of the deadliest pandemic in history. Barry was the only non-scientist on the federal government's Infectious Disease Board of Experts, and he's worked with the national academies and several federal entities on influenza preparedness and response. John Barry, welcome to the podcast.
My pleasure. Looking forward to the conversation.
Before we dig into the past year, as well as 1918, let's look ahead for a moment, if we might. Do you see an end to the pandemic yet, say in another 6 or 8 months?
Sure, if you extend it out long enough. Real question is the variants. The virus is still the boss. And the variants that are already out there, I think we can handle without serious problems. My concern is a variant that we haven't seen yet that may be a lot more nasty, and that could delay things.
And then the vaccine, of course, we're getting that going.
Yeah, I mean, that's well underway in this country. Biden just promised that everybody would be eligible by May 1st. That doesn't mean they'll all get it. Then the issue becomes how many people don't want to take it. All that factors into herd immunity. In terms of the emergence of more variants, that is an issue. So you need to get the vaccine around the world. It is in our self-interest to send vaccine all over the world.
In President Biden's address, he said no one could have imagined what awaited us. But 1 year ago, in March 2020, you wrote a column in the New York Times that is remarkable in its accuracy. We remember March as the watershed moment, but the virus, of course, had been spreading for months prior, since late 2019. So in a sense, we missed our chance to prevent this from becoming as bad as it got, right?
Yeah, we certainly could have done a lot better than we did. I mean, we could have done orders of magnitude better than we did in the United States. I don't know that it would ever have been possible to keep this entirely in a box, as we did with SARS and Ebola, chiefly because the transmission is so much different. In Ebola and SARS, you don't transmit the virus until you're really, really sick. Nobody's walking around with Ebola or SARS when they can transmit it. And here the big problem, of course, is asymptomatic transmission. So completely containing it, that would have been awfully difficult. But again, doing much, much, much better than we did do, that should have happened. Before the pandemic, the World Health Organization rated countries around the world on their preparedness for pandemic, and they rated the United States #1. And on per capita deaths, we're not the absolute worst, but we're pretty close to it. Not a good place to be.
We were rated #1 in preparedness by the World Health Organization. That's amazing.
Right.
I want to talk about the misinformation that came from the Trump White House. But first, let's talk about the WHO and Chinese authorities. Where did they go wrong? I mean, obviously, the Chinese weren't forthright immediately when they needed to be.
Right. What goes on behind the scenes between WHO and China and what goes on publicly are two entirely different things. The problem with WHO is they don't really have adequate authority. All they can do is push privately. Publicly, they were praising even while they knew the Chinese weren't cooperative. Whether public statements would have made China dig in its heels more or would have forced them to open, we don't know the answer to that. Obviously, what did happen, the way it did work out, was not very successful in terms of getting access.
I remember in late 2019, I was an anchor for Bloomberg Radio. doing business updates and talking about how investors or global economic figures were confident that the virus was going to be contained in China. Thinking back on those reports I was reading, I mean, how mistaken. I guess it shouldn't have been a surprise a novel virus spread all over the world.
Look, I know in January I wrote an op-ed that, in fact, the working title was, "This virus cannot be contained," although I ended up pulling my punches and it ran under the title, "Can this be contained? Probably not." It was evident to me, and I'm a layperson, just following the news. I had no special insight by the middle of January that we were in serious, serious trouble. And then when China closed down Wuhan, a city of 11 million people, that's not a casual act. There was some thinking that it was really like SARS, which, as I said a minute ago, you can contain because there is not asymptomatic transmission. You're already flat on your back, not walking around. So if you were thinking it was just like SARS, then even if it got around the world as SARS did, we'd still be able to contain it. So maybe there was some of that initially, but certainly not once Wuhan closed down. It should have been totally obvious to everybody.
Last March, you wrote, "The most important lesson of 1918 was tell the truth." That didn't happen then, as you wrote in your book, The Great Influenza, and it didn't happen in the United States last year either. Let's start with 1918. One apparent problem was it was called the Spanish flu, although it may have originated in the United States. Where did the term Spanish flu come from, and why was that a problem?
In my book, I advanced the hypothesis that it did start in the United States and Kansas. I've actually backed off that, which you have no way of knowing. But the book originally came out in 2004, and there's been a lot of work on 1918 epidemiological since then. And it's still possible it started in Kansas, but we just don't know where it started. In terms of the Spanish flu, it was the war. Spain was not at war. The European countries were all censoring their press. Anything that hinted at being bad news that might hurt morale and therefore hurt the war effort, they weren't writing about it much. But Spain was, a lot of people got sick in that first wave, and the king got sick, which of course generated a lot of publicity. So it became known as Spanish flu.
Did calling it Spanish flu prevent the best possible response from taking place? Was it a hindrance at all?
I don't think the name did. I think the fact that we were at war was a major hindrance. Just as I just mentioned, the European countries censored their press and didn't want any bad news out there. The U.S. didn't actually censor its press, but there was a tremendous amount of self-censorship. There was a sense of patriotism. The U.S. had passed a law that made it punishable by 20 years in prison to utter, write, print, or publish anything negative about the government of the United States. This was interpreted as criticizing any action the government took. They actually sentenced a congressman to prison for 10 years. A newspaper early in the pandemic started reporting the truth. They were threatened with prosecution under the law. So there was this effort to say just wonderful things about everything that was happening to keep spirits up. So it was, referred to as ordinary influenza by another name. The comment widely repeated by one national public health leader, or you have nothing to fear if proper precautions are taken. Comment from the Surgeon General of the United States, both of which were nonsense and I think created a lot of problems.
You observe that trust in authority disintegrated in 1918. How so? Because
people were being lied to and they knew they were being lied to. Nobody in 1918 thought it was a hoax. This virus was much, much more virulent than COVID-19. Not only that, it killed young children and adults, 20 to 50. Here's a statistic which has never been published. A guy named Carter Metcher, who is then a National Security Council now at the VA, did the computation. He said children below the age of 5 in 1918 died at a rate equal to deaths from all causes today over a period of 23 years. So think of that if you're a parent. 23 years of all-cause deaths compressed into just a few weeks in 1918. Because that was another marker of the 1918 pandemic. It was incredibly fast. a fraction of the time of COVID-19. The other thing is the young adults. Probably the median age for death was 28. Metropolitan Life found that over 3% of all factory workers died. Over 6% of all miners died in the age group 25 to 45. Again, this isn't a period in any particular community. The disease passed through that community in 6 to 10 weeks. And those weren't case fatality numbers I was giving you. That was mortality. So the case mortality would have been like 10% for factory workers, roughly 20% for miners.
My gosh. You mentioned the misinformation dispensed by public officials then. That continued even after the corpses started to pile up, right? Philadelphia was
Right.
digging mass graves in Philadelphia, and even then they weren't
Right.
issuing warnings?
Right. One of the craziest comments that, and this wasn't even a quote from an official, this was a newspaper itself. Philadelphia is one of the hardest hit cities. They're digging mass graves, as you say. You know, they literally had priests driving horse-drawn carts down the street, calling upon people to bring out their dead. And when they finally, very late in the game, closed schools, theaters, saloons, and so forth, one of the newspapers actually said, "This is not a public health measure. You have no cause for panic or alarm." Now, the readers knew this was utter nonsense because their neighbor, their spouse, was not only dying, and some of them were dying with horrific symptoms. And sometimes they were dying in less than 24 hours after the first symptom. So, as I said, because of that, nobody thought it was a hoax. But when you're reading this stuff in the newspaper, all it means is you can't believe anything you read or are told. And your trust in authority disintegrates when that happens. And you're forced to rely upon yourself and your family. Society, when that happens, I think society is based ultimately on trust. And when trust dissipates, society begins to fray. So in Philadelphia, you have reports of people who are starving to death because nobody had the courage to bring them food. When people who ran volunteer services in Philadelphia were desperate, issuing desperate pleas for volunteers, nobody was showing up. It wasn't just Philadelphia. You see the same reports, and even in rural communities where you would expect family to be everything.
Woodrow Wilson basically said nothing publicly about the pandemic, correct?
He never made a public statement of any kind on the pandemic. You know, he was involved in decisions to send troops overseas, and he was advised not to do that. The troop ships were almost like floating coffins. He said, no, if you die on a troop ship, it's like dying on the front line. We're at war. He was actually also advised immunity did develop. So if he had sent troops from training camps where the disease had already passed through, they would very likely not get sick on board ship. And he was asked to at least rearrange the shipping schedule, tell the Army General Staff to do that. And he wouldn't even do that. He was, you know, a very unusual person, sort of obsessive compulsive. And he was totally obsessed with the war. That was it. Nothing would distract him from what he was focused on. To my knowledge, he didn't make many private comments about it either.
But he had to know the extent of the carnage, right?
Oh, yeah, he knew. I mean, for example, the Army in the early September or middle of September, actually late September, September 26, 1918, canceled the draft because they couldn't. It wasn't because the war was close to ending. Nobody knew the war was that close to end. There was anticipation that it would take a major offensive in 1919. They were still bringing millions of people in, training them to go to war. But the Army canceled the draft because all the training camps were overrun with influenza.
Did the federal government have any role? I mean, we didn't have federal bureaucracies then like we do now, but was there any role for the federal government in combating the pandemic?
Well, as you say, the government was quite a bit different.
Yeah,
there
small.
could have been there could have been a bully pulpit. Certainly, if you could imagine Teddy Roosevelt still being president, you can be pretty assured that The federal government would have had a major role in what happened. There were no institutions. We did have a Surgeon General. There was a public health service. They were involved and quite active, but didn't have many resources. The military, a huge proportion of the doctors and nurses in the country were actually in the military. Not all, but a huge percentage of the leading scientists in the country were in the military. What is now Rockefeller University, then Rockefeller Institute of Medical Research, was incorporated lock, stock, and barrel into the Army. Everybody there became an officer. The best scientists in the world were in the military, and they tried hard to prepare. But this thing moved so fast, and what we knew they were great scientists. They're as good as any we have today. But of course, their technology and their knowledge base was a tiny fraction of what we have today. So the federal government could have done a lot more in terms of moral leadership and bully pulpit. And as I say, if you could imagine Teddy Roosevelt as president, no doubt it would have. But as it turned out, it didn't. And there was no Tony Fauci in 1918.
The first wave was relatively mild, right?
More than relatively mild. The best data, really solid statistics, are from the military. So in the first wave, the French army had 40,000 soldiers hospitalized. They had fewer than 100 deaths. The British Grand Fleet, which patrolled the coast of Europe, had 10,313 sailors report to sickbay, missed duty in the middle of a war. Only 4 died. So that's pretty mild, and particularly when you realize that the standard of care, there was very little you could do for anybody then. Everywhere in the world, really, that first wave was generally incredibly mild, but the virus mutated. The other thing that was notable about that first wave, and quite widely noted, it was not nearly as transmissible as ordinary influenza. For example, I just said 10,000 sailors in the British Grand Fleet got sick. There were 90,000 sailors in the fleet. So for only a little over 10% to get sick in the close quarters of a ship for a disease as transmissible as ordinary influenza, that's not a lot. The first wave tended to hit places and then peter out. It wasn't even noticed in most American cities at the time. In fact, there was only one city that made any notice of it in the first wave. That was Louisville. But then the virus mutated. It became much more transmissible. And as it became much more transmissible, it became much more lethal as well. It was so different. It was so immediately apparent that this thing was an entirely different kind of virus, unlike anything that humanity had seen since the Middle Ages, really.
You mentioned before how public health officials took too long to close down businesses and schools, but did people, to borrow a modern term, social distance on their own when they realized how deadly this second wave was?
Well, very much so. And it varied city by city. The federal government didn't issue any orders or recommendations until quite late. The states didn't take much action. It took a little bit of time for the disease to spread through the country. So cities that had watched what had happened in Boston, Philadelphia, and so forth, some of them took pretty early action. And there was actually last year a study by some pretty conservative economists that looked at 1918, and they concluded that cities that closed down earlier and stayed closed longer actually had a better economic recovery. The other thing is looking backwards, cities that employed the closing orders sooner and longer had a much better outcome in terms of people getting sick and dying. Now, specifically regarding your question, yeah, people were scared and people did isolate themselves. To go back to Philadelphia, I quote one, he was a med student at the time, but under the emergency, he was almost in charge of an emergency hospital. And he lived 12 miles from the hospital. When he went home every night after work, a drive of 12 miles, he saw so few cars on the road that he started counting them. And one night in 12 miles in the third biggest city in the United States, he did not see one other car on the road. He said the life of the city is almost stopped. And there's a photograph in the book, which is a very undramatic photograph until you think about it. It's Manhattan. You see a couple of city workers in the foreground with masks on, and you see cars parked on the curb. But then you think, wait a second, this is Manhattan. There's not a single car moving on the street, not one. There's nobody on the sidewalk.
So, John, the similarities between 1918 and now are painful, really. How do you assess President Trump's performance when it came to providing accurate information to the public 1 year ago?
On a scale of 1 to 10, I'd give him about a -5. I would give the administration credit for one thing, and that's warp speed. You know, the idea for it came from the permanent bureaucracy. It wasn't a political appointee. But Trump could have said no. They were spending a lot of money, and there were a lot of people who thought that it wouldn't work. So he does deserve certainly some credit for warp speed. But other than that, there's not a lot that he did right.
George Packer wrote, "The crisis demanded a response that was swift, rational, and collective. The United States reacted instead like Pakistan or Belarus, like a country with shoddy infrastructure and a dysfunctional government whose leaders are too corrupt or stupid to head off mass suffering." He went on to say the administration squandered 2 irretrievable months to prepare. From the president came willful blindness, scapegoating, boasts, and lies. From his mouthpieces, conspiracy theories, and miracle cures. The words of George Packer. Do you agree with that?
Let me respond in a different way. If you look around the world at some of the countries, look at the countries that have done the best. You know, South Korea, Thailand, Taiwan, Singapore. And you say, okay, those countries aren't like us culturally. We couldn't have done that here. And I say, really? What about Australia? Now, I have no doubt that Australia was influenced by what its neighbors were doing geographically. But culturally, Australia, you might argue, is more like the United States than any other country in the world, including even Canada. You know, very much individualistic, almost a cowboy type culture. Australia's had 909 deaths total. They've had 4 deaths since the middle of October. If you adjust for population, their death toll would equal about 12,000 in the United States. We have almost 530,000. Culture, very similar, individualistic, and, you know, it's the same virus. You have the same tools to work with. The difference was leadership.
The low point for me, anyway, was when President Trump suggested people could zap the virus with ultraviolet light or pump themselves with disinfectants. He also pushed hydroxychloroquine, and he wasn't the only one to push quack remedies. All of that soaked up so much time and focus and energy to debunk it when we really needed to be focusing on other things. Was this kind of madness a problem in 1918?
Well, it didn't come from the White House, you know, because the White House wasn't saying anything. The doctors were so desperate to try to find anything to work. I don't know if you want to call it madness, but they were trying everything, including there's one article in the Journal of the American Medical Association. One doctor reasoned that one way to get oxygen into the bloodstream might be to give patients hydrogen peroxide intravenously. And he actually did that. And half of his patients died. I think 12 died and 13 recovered. And he thought that was very successful. You know, in Trump's defense on one thing, on the hydroxy, there was an early paper, which was later disproved, that made hydroxy look pretty good. So he latched onto it. But to continue to push it, and people are still pushing it. You know, the only time in his entire presidency, once he became president, really, the only time in his presidency he cracked 50% in the approval was almost exactly a year ago when he said we're at war with the virus. And he looked like he was taking charge and being a leader and calling for the 15 days and so forth, later extended. And people rally around leadership. If he had, from that point forward, although we had already made multiple mistakes, from the middle of March, if from that point forward, he had tried to demonstrate real leadership and not politicize this, number one, I think there'd be a lot more Americans alive. And number two, he probably would have gotten reelected. But instead, he backed away from it. He saw it as almost as a partisan attack, and people on the right bought into that. It was not a partisan attack.
And President Trump never fully endorsed wearing masks, although when it came to giving out contradictory or confusing information about mask wearing, there's plenty of blame to go around. Although at the time, last March, we didn't have all the information we have now, right?
That's correct. And frankly, I was one of those people who, when asked early, I said, no, I don't think masks for the general public. My own statements went back to history. In 1918, they actually knew that putting a mask on somebody who was sick helped prevent the spread of respiratory disease. They'd run experiments. They could tell you how far droplets traveled and things like that. And a lot of cities imposed masking ordinances. But after the pandemic, epidemiological studies indicated that was not useful. The decision was made in the public health community at the time that if something happened again like that, it probably wouldn't be worth the effort to try to get the general public to do it. And based on that, that was my position early in this pandemic. But while there is some asymptomatic transmission and with influenza, it's nothing like COVID-19. And it was not apparent early on how much asymptomatic transmission there is with COVID-19. There was a CDC study maybe a month ago, 59% of the cases were spread by people at a time when they don't have any symptoms. And that changes the equation on the masks quite a bit. I think it's been very well demonstrated around the world that masks are very effective. They are not perfect. They reduce risk. They decrease transmission. I'm in New Orleans, and I remember somebody claiming to me when somebody got sick who wore a mask, well, that proves masks don't work. I said, look, we're in New Orleans. Levees aren't perfect. Levees reduce risk. That doesn't mean you're never going to get a flood. Would you rather live in New Orleans without any levees?
This person who made that remark to you, they were obviously a scientist at a leading institution, right? Yeah. We can do an entire podcast about armchair scientists and quackery, but let's wrap up with this, John Barry. So much of the past year has been depressing, not just the death and misery and the disruption to daily life, but the division, the politics around things like masks. It's leaving me rather pessimistic for when the next pandemic strikes.
Well, I often quote Hegel, who said, what we learn from history is that we learn nothing from history, which would sort of fit into what you're saying. And there will be future pandemics, that is a guarantee. How will we react? I think that leaders around the world will see the difference between countries this time around. You almost have experimental controls. Some countries perform pretty well. Some countries perform pretty poorly. And it is in the political self-interest of any political leader to perform well. So I hope that the example of these various outcomes would convince politicians in the future to do a lot better. Those countries that have performed well, number one, told the truth. Number two, took the disease very seriously from the very beginning. And number three, did use non-pharmaceutical interventions. If the next pandemic occurs 10 years from now, it'll be fresh in everyone's mind. If it occurs 50 years from now, maybe that lesson will be forgotten.
Well, let's close with Camus from his classic The Plague. A pestilence isn't a thing made to man's measure. Therefore, we tell ourselves that pestilence is a mere boogie of the mind, a bad dream that will pass away. But it doesn't always pass away, and from one bad dream to another, it is men who pass away because they haven't taken their precautions. Our townspeople were not more to blame than others and thought that everything was still possible for them, which presupposed that pestilences were impossible. How should they have given a thought to anything like plague, which rules out any future, cancels journeys, silences the exchange of views? Let's thank John Barry for sharing his views with us today. On the next episode of History as It Happens.
We're ending all American support for offensive operations in the war in Yemen, including relevant arms sales.
The U.S.-Saudi marriage is a messy one, as human rights activists call on the Biden administration to punish Crown Prince Mohammed bin Salman for the murder of Jamal Khashoggi. But real politics seems to be winning out. That's next as we report History as It Happens, a podcast from the Washington Times.